Okay. So, I mean, it was not like patients didn't show up needing that. You just kind of did it to practice.
Yeah, primarily.
Okay.
There
Okay.
were a few, but most of them were practice. We would do them if we had a patient that was kind of willing to, let us practice, or we actually did them on each other a lot.
Okay. Now, on your the ones that you did do during residency, was the hospital a busier ER, or was it
Oh yeah,
did it
it was
busier than your
extremely
current
busy.
practice?
Yeah,
And
definitely. I
so
mean,
maybe
there were.
that's why they just saw more. Would that be a true assessment, or?
I think so, because the busiest place that I work currently is, I think, 85,000 annual visits, and the place that I did residency was 130,000 visits. So a very, very busy place.
Okay. Okay. I'm just taking notes. And
Sure.
what about, so you mentioned optic nerve sheath diameter. It's one of the measurements you do for papilledema. Are there any
Mhm.
other standardized measurements that you're required as an ER physician which part of your training?
Yeah, the biggest one, back to the cardiac ultrasound, is when we're estimating the ejection fraction. It's kind of a rough, they're not nearly as specific as your formal echo, but we're looking at like the left ventricle and the mitral valve, and we're looking at the distance between when that valve opens and closes, the distance between the wall of the ventricle and the valve. So if it's 0 to zero point 0.6 centimeters, we'd say that's a person that has good squeeze, or roughly a normal EF. So you're thinking somebody who has an ejection fraction of probably 50% or above. If that measurement was between zero point 0.6 centimeters and 1.2 centimeters, we would say maybe that's a little bit compromised, so slightly
Okay.
decreased.
You kind of just eyeball it and then get the measurement, the distance measurement.
Yeah.
Okay.
And then obviously anything greater than 1.2 would be, very poor ejection fraction, likely to be 15% or less.
Mm-hmm. Among your patients, how many of them are actually pediatric patients?
Very few. A lot of the places that I work are in pretty close proximity to like a specialized pediatric facility. So we do get some, but most of those patients go elsewhere. Another kind of measure, just to backtrack a little bit in terms of measurement, The other big
Yes.
one that we do is if we're looking at gallbladder ultrasounds, particularly the right upper quadrant. So there's a few kind of key measurements there. The thickness of the gallbladder wall, looking for 4 millimeters or less to be normal. Anything greater than that kind of concerning for infection. And then also measuring the common bile duct, which that can be a little bit increased with age. But in anybody under 50, you're essentially looking for it to be
Do you
4
kind
to
of
5.
measure it where the portal vein is, along when it's parallel to the portal vein, or what location do you measure it at? Does it matter?
That's exactly where we measure it, and the primary reason for that is just identifying the two structures. So very often we'll put on color flow in that view,
Right.
and you'll see the vasculature, and then the one that you don't see any flow through is going to be just by default your common bile duct.
Okay. And then, sorry, you were talking and I interrupted. You said common bile duct, and what else is measured? Gallbladder wall?
Common bile duct, gallbladder wall. Yeah, those are for that study. Those are the two key measurements.
Do you ever ultrasound the pancreas at all, or when anything's suspected? I know there's limitations there, but
yes, not me personally. One of our ultrasound faculty in residency was trying to teach me how to do that, but I just was never really able to pick up that skill in any kind of meaningful way.
Okay. What about measurements of the spleen or kidneys or prostate or any of that?
No, for us, for our purposes in the ER, those are less kind of clinically relevant. The only thing that we really look for in terms of the spleen is looking at that fast to see if there's any blood or free fluid between the spleen and the